The U.S. Supreme Court upheld a key part of President Barack Obama's historic health care law on Thursday, June 28th. In a 5-4 decision, the court ruled the individual mandate that all Americans buy health insurance is constitutional. 5 justices agreed the penalty someone must pay if he or she refuses to buy insurance is a kind of tax that Congress can impose using its taxing power. The legislation passed Congress in early 2010 after a monumental struggle in which all Republicans voted against the measure. The GOP has indicated they will try and use the Supreme Court decision to rally their supporters against health care reform. Joining us now from the nation's capital in our Washington, D.C. bureau is Bureau Chief Chris Casteel. And Chris, thanks for your time today. I know it's a busy day out there.
Yep, you bet, Dave.
Chris, we'll get into how this verdict will impact Oklahoma, and we also have some questions from our readers, beginning with Guy Kane, and his question is similar that I'll open with. Guy asked, if Oklahoma has opted out of the new law, does that mean I'm exempt from the individual mandate?
Well, that's a really good question, and the fact is that nobody can opt out of this law now because of this decision today. I mean, the Supreme Court upheld the individual mandate, not under the Commerce Clause, which is really what was argued before the Supreme Court. What the government's argument, main argument was that under the Commerce Clause, the government had the power to regulate, to tell people to purchase this. However, it was upheld, and it was upheld as a taxing power of the U.S. government. And so, the individual mandate, as it applies to everybody in every state, will go through. Oklahoma cannot opt out of that. And so that will go into effect in 2014 unless there is some political action that forestalls that. But in regard to Oklahoma as well, the thing that Oklahoma can opt out of because of this decision today is the expansion of Medicaid. And that was a big part of the health care bill's mechanism to ensure more of the Americans, the low-income Americans who are uninsured, was to expand Medicaid, which is the state federal program for the needy, for the disabled, for the elderly. And under the Health Care Act, what was going to happen was the states would be required to expand it to everybody who was below 133% of the poverty line. And if they didn't, then the state was going to withhold all of their Medicaid funds, including the ones that they get now for their basic Medicaid programs. What the court said was that's unconstitutional. Now, the states will have the option, and we'll have to see where Oklahoma goes with that. Will they decide to do the expansion, which will cost Oklahoma money, even though the federal government's going to pay a huge portion of it? It will cost Oklahoma tens of millions of dollars a year to do that expansion. So as far as that goes, that will be a political decision back in Oklahoma.
We're chatting with the Oklahoma's Chris Casteel from our Washington, D.C. bureau via Skype. And we're talking user questions that have been submitted on newsok.com. And we'll move on to Rudy Nelson's question. He submitted the following: what else can the government make us buy and impose a tax if we don't?
That's another good question. That was really one of the big questions when this was argued a few months ago about the Commerce Clause. If the government can force you to buy something, can force you to buy health insurance, can't it force you to buy anything? Now, I mean, this was a pretty narrow opinion, and it was by the dissenters, the justices that disagreed with this, thought that it was outrageous that the majority of the court found the authority to tax in this law, that they called it a law or called it a tax, because throughout the bill it refers to it as a penalty. So it does leave open that question. What else could the government use this new, broad taxing authority to do? Because as the dissenter said, and nowhere in the bill does it call it a tax, nor is it in the part of the bill that would be a tax. Even though it is administered by the IRS, it's repeatedly referred to as a penalty. So, as far as this decision goes, I think that's going to be, something that will be interpreted, for the months and years to come, as the limits on the government's authority to do that.
Moving on to the next question, Marty Payne asks, can this be overturned if President Obama is not reelected?
Well, yes, it could. It's, in short, yes. But you would also have to get repeal through both houses of Congress. So the House, which is controlled by Republicans, in the last couple of years has repealed much of this bill, voted to repeal much of this bill, I should say. But the Senate has not taken that up. So if the House remains Republican after the 2012 elections, there's no doubt in my mind they will do the same thing. The question is, who controls the Senate? And it's not just whether the Republicans can get a slim majority of the Senate. They would need more than a slim majority. Even if Mitt Romney were to win the presidency, you would have to get repeal through both houses of Congress to get that to a Republican president's desk.
We're talking with the Oklahoman's Chris Casteel via Skype from our nation's capital at our Washington, D.C. bureau, and that analysis there from Chris leads us to this question from Matthew Craig, who wants to know, why is there such a huge political divide on this issue? Matthew says, I'm a moderate Democrat, but split evenly on the social issues.
Well, I think, Matthew, because it's maybe there's nothing more personal than health care. And, you hear a lot from conservatives like Tom Coburn, this bill gets between you and your doctor, sets up death panels, Sarah Palin said, all the things that you've heard about it. But it also, I think, is a very representative of the kind of issue that is debated on the government's reach, how, the power of the government. And I think when it comes to health care, even though obviously much of health care is, government run, Medicare, Medicaid, a federal and state program, veterans care, there is a lot of government participation and regulation in the healthcare industry. But I think that there's just something about the whole doctor-patient relationship, and again, getting back to the reach of the federal government into that part of healthcare that people deem to be very personal.
And one final question we'll go over. Carrie Sharp asks, how much will the tax be for the uninsured?
That will vary, and it will start out in 2014, and I believe it really would be the 2015 taxable year. It would start out as the larger of 9, and this is per person, so if it's a family of 3, it's all 3 people. I believe it starts out at $95 or 1% of income. In the next year, 2015, it would go to $325 or 2% of your income. And in 2016, the penalty or tax is $695 or 2.5% of your income. And then after 2016, it's that $695, 2.5% stays in place along with cost of living adjustments. So it would just go up, whatever the CPI is in that given year.
Very good. Chris Casteel from our Washington bureau. A busy day for you, and we thank you for your time.
All right, Dave, thank you.
And for those who have submitted questions, we thank you as well. You can join the conversation online at newsok.com. Hundreds have left comments already, and you can share yours at the bottom of most articles at NewsOK. Oklahoma's governor, attorney general, congressional delegation, and the president of the state chamber were unanimous Thursday in their criticism of the Supreme Court's decision to uphold the Affordable Care Act. And you can read each of their statements online at newsok.com, as well as the Supreme Court's decision. For more coverage, pick up a copy of the Friday Oklahoman with additional coverage this weekend in the Oklahoman, and newsok.com will be continually updated as well.